We're gathered here today at Shady Grove Adventist Hospital to celebrate breastfeeding. The Department of Health and Mental Hygiene in the state of Maryland has decided that there are 10 principles associated with healthy populations related to breastfeeding, and they're here to promote that, and they've chosen us as the hospital to launch it.
At DHMH, we put together a group of stakeholders, and certainly that included representatives from Shady Grove Adventist, as well as other hospitals, physicians, community advocates and organizations, to take a look at what could we do better in Maryland to really pump up our breastfeeding rates. The recommendations are to follow the 10 steps, either for the Baby Friendly Initiative, that's the International World Health Organization pathway, or the alternative, which we developed, kind of our homegrown Maryland lookalike, which is Maryland's Best Practices Hospitals. So either way, we'll develop an environment in the hospital that really supports breastfeeding for babies.
Baby Friendly is really about consistent breastfeeding education. The same education out in the community, the same education from the moment they walk into their physician's office, discharge, and then your community support groups. Everybody needs to be teaching evidence-based practice and the same information.
The state of Maryland breastfeeding guidelines are 10 specific guidelines that help hospitals get on board with promoting breastfeeding to help our newborns in the state achieve better growth, better overall health, immunity, and development.
The guidelines from the state for breastfeeding really is probably one of the more important measures we're taking relative to healthy populations. It's starting life for the newborns on the right foot for the mom. We're working toward really meaningful bonding, not just nourishment, but we understand that best practice and a lot of the professional literature supports that breastfeeding sets the child up for a healthy life.
Shady Grove Adventist Hospital has over 5,000 deliveries each and every year. And for a hospital to provide this level of commitment, and we've done this even before the state recommended these breastfeeding practices, it allows our community's babies to be healthier, to be stronger, and smarter.
I think it's an exciting day, and we're thrilled that out of all of the hospitals in the state of Maryland, we were chosen to launch this.